Good day to each and everyone. I am Evan Obahian, and today let's talk about the netiquette rules and guidelines. So, netiquette simply means internet etiquette, or the proper way of using the internet. Since most of us are always online, it is important to know how to act responsibly and respectfully in the digital world. Now, let's talk about the general netiquette guidelines. First, do protect personal information. Keep personal information such as your full name, address, phone number, and school name private. Only share this information with trusted individuals. These details may seem small, but in the wrong hands, they can put our safety at risk. As future nurses, we also have to remember that protecting personal information is part of our patient's confidentiality. Just like we would never share a patient's private details, we should also guard our own information online. Second, do report cyberbullying. If you are a victim of cyberbullying or witness it happening to someone else, report it to a trusted adult and the appropriate authorities or platform administrators. As a student nurses, we are taught to care for people and to stand against any form of harm. By reporting a cyberbullying, we help protect others, promote respect online, and create a safer digital environment for everyone. Third is do think before you post. Be mindful of what you share online. Once you post something, it's difficult to erase. Consider the potential consequences of your posts on your reputation and future opportunities. Everything we share online can leave a permanent mark. Once posted, it is very difficult to take back. That's why we need to be careful and consider the possible consequences before clicking the post. And as a student nurses, our online behavior reflects not only on us but also on the profession we represent.
We also need to do use strong and unique passwords, creating strong passwords using a combination of letters, numbers, and symbols. Use different passwords for different accounts to prevent unauthorized access. So we must create our password that is strong enough for not to be um, hacked by anyone. So this would be um, made by the combination of letters, numbers, and symbols. So by having that kind of combination, we can secure a very strong passwords. And also, if we have some different accounts, we must use different passwords. So it would be much safer for us to prevent unauthorized access of our account. Next is do verify online friends. So be cautious when making online friends, especially if you haven't met them in person. So nowadays we must be cautious enough when making online friends because we don't know what that certain people is up to with us. So we must be cautious enough for us to be safe in the internet. So do not share personal information or agree to meet someone from the internet without involving a trusted adult. So this is very important, not sharing our personal information to anyone or agree to meet them personally. So if we want to meet them personally, we must verify them well, or the time that you will gonna meet with that person, we must um, bring or involve a trusted adult for us to be safe. If because we might because we don't know what gonna happen, so at least we have person that may protect us. We also have do be cautious with links and downloads, so avoid clicking on suspicious links or downloading files from untrusted. source. Moreover, be especially cautious of email attachments or links from unknown senders. So actually, this is very rampant nowadays. There are a lot of suspicious links that have been circulating online. So we must be cautious enough on not clicking on these suspicious links or replying on random emails not um, that is came from unknown senders. This is for us to prevent any unauthorized access of our personal information. And next is do keep software updated. So regularly update your devices and software to patch security vulnerabilities. And also use antivirus and anti-malware software to protect against threats. So we ought to know that updating our devices and software could really benefit us, especially in a way that it can patch our security vulnerabilities. So it means that it's much more safer for our devices and software to be accessed by anyone or predators, online predators. So by doing this, we could prevent from that kind of event. So also by using antivirus and anti-malware software, it can protect our devices, our software from any threats, especially accessing our personal information from our devices and software. We also have do practice digital etiquette, so be polite and respectful when communicating online, including in emails, chats, and comments. Also, think before you type and remember that words can have a lasting impact. So, nowadays, communicating through online had become a significant part of our daily basis. So, in communicating through online, we must um, construct or formulate our messages in a much more polite and respectful manners for us to have that proper etiquette in communicating.
Be mindful of timing. In professional settings, the timing of communication is as important as the message itself. Sending emails late at night may disturb the recipient, especially if they receive real time notifications. This practice can also appear unprofessional, as it may give the impression of poor time management or lack of boundaries. Scheduling emails during appropriate work hours demonstrate respect for the recipient's time. It shows that the sender values healthy work life balance, an important aspect not only in the healthcare but also in all professional environments. Proper timing of messages also increases the likelihood of receiving a prompt and thoughtful response, since most individuals actively check and reply to emails during their work hours. So, for nursing students and future healthcare professionals, maintaining professionalism in communication is essential. Nurses work in teams where collaboration and respect are vital. By observing simple practices, such as sending or scheduling emails at the right time, we uphold courtesy, foster healthy boundaries, and strengthen professional relationships. Overall, avoiding late night messages and instead scheduling them during appropriate hours reflects professionalism. This small yet meaningful practice contributes to more effective communication, healthier work culture, and a more collaborative environment in healthcare beyond. Fundamentals in nursing etiquette, maintaining confidentiality and privacy in nursing etiquette. In nursing practice, one of the most important ethical and legal responsibilities is the protection of patient confidentiality and privacy. Patient information is considered highly sensitive, and its protection is mandated by laws such as the Health Insurance Portability and Accountability Act in the United States and the Data Privacy Acts of 2012. In the Philippines, these laws ensures that healthcare providers, including nurses, handle patient data responsibly and protect it from unauthorized access or disclosure. So, we must understand that maintaining confidentiality goes beyond simply keeping quiet about patient details. It requires a professional commitment to safeguarding all forms of patient information, verbal, written, and digital. For example, nurses must avoid discussing patient details in public places such as elevators, hallways, or cafeterias where others may overhear. Sharing patient information with individuals who are not directly involved in their care also violates confidentiality, even if done unintentionally. In the digital age, confidentiality extends to the online environment. Nursing informatics emphasize the proper use of technology in managing healthcare data. Nurses must never post, email, or message patient related information through unsecured platforms such as social media, personal emails, or messaging apps. Even unintentional sharing, such as posting a photo of a patient's chart, bed number, or identification bracelet, can compromise privacy and lead to serious legal and ethical consequences. Hospital and healthcare institutions provide secured electronic health record or EHR systems, and they should be the only approved platforms used when handling digital patient data. Respecting confidentiality is not only a legal requirement but also a professional and ethical duty. It builds trust between nurses and patients, reassure patients in their personal information is safe, and strengthens the integrity of the healthcare system. As future nurses, practicing digital professionalism and adhering to etiquette in both personal and professional communication are crucial to ensuring safe, secure, and ethical nursing care. So, overall, maintaining confidentiality and privacy requires vigilance in all settings, whether face to face or digital. By applying nursing informatics principles and respecting etiquette, we uphold our responsibility to protect patients, maintain their trust, and promote the highest standards of nursing professionalism. Digital etiquette in nursing practice. In the digital age, communication has expanded beyond face to face interactions and into online platforms such as email, messaging applications, discussion forums, and social media. For nursing students and professionals, practicing digital etiquettes or netiquette is essential to maintain professionalism and uphold the ethical standards of the profession. Online interaction should have always reflect the same courtesy, respect, and responsibility that are expected in personal communication with patients, colleagues, and the healthcare team. Professional communication in email must follow formal standards. These include using proper greetings, complete messages, correct grammar, and respectful tone. Messages should remain clear and concise, focusing only in essential information. Similarly, when engaging in online forums or academic discussions, nurses and students are expected to contribute respectfully and provide evidence-based insights. This is not only ensures professionalism but also strengthens critical thinking and knowledge sharing within the healthcare community. Social media presents another important aspect of digital etiquette. While it can be powerful tool for a decency or advocacy, education, and professional networking, it can also harm one's credibility if misused. Nurses must avoid posting patient cases, photos, or any identifying information as this breaches confidentiality and violates privacy laws such as the Data Privacy Act in the Philippines. Posting offensive remarks, unprofessional comments, or inappropriate content can damage both professional and institutional reputation. Since nurses are trusted members of society, maintaining a positive and professional digital presence is part of safeguarding the image of the nursing profession. Overall, digital etiquette is more than just good manners online. It is a reflection of one's professional and ethical responsibility by as a nurse by practicing formal, concise, and respectful communication and by using social media responsibly. Nurses demonstrate integrity, protect patients' rights, and uphold the standards of the healthcare profession in both real and virtual environments. Respectful communication in nursing practice. Respectful communication is a vital component of professional nursing practice, whether addressing patients, families, colleagues, or other members of the healthcare team. Nurses are expected to uphold politeness, courtesy, and professionalism in all interactions. This standard applies not only in face-to-face settings but also in digital communication, such as emails, text messages, online forums, and social media platforms, in both written and spoken. Exchanges, nurses must avoid the use of offensive language, discriminatory remarks, or insensitive jokes that may harm relationships and diminish trust. In digital communication, typing in all capital letters should be avoided as it can be interpreted as shouting. Similarly, sarcasm and ambiguous statement can easily be misinterpreted without the benefit of nonverbal cause or cues, leading to unnecessary conflict or misunderstanding. Respect is the foundation of trust, and in nursing, trust is critical to build therapeutic relationship with patients and effective collaborations with the healthcare team. A respectful approach to communication fosters open dialogue, enhances teamwork, and support patient-centered care. When patients and families feel respected, they are more likely to share important information, follow medical advice, and engage positively in their healthcare journey. So, in the nursing informatics, as a third year nursing student, respectful communication also applies to digital platforms where professional interactions occur. Nurses must model professionalism by maintaining a respectful tone in emails, online discussions, and interprofessional messages. By doing so, they contribute a culture of mutual respect, safety, and collaboration within the healthcare environment. So, respectful communication is not just a courtesy, it is a professional obligation. By avoiding offensive language, sarcasm, or unprofessional online behavior. Nurses, nurses must demonstrate integrity and uphold the values of the profession. Ultimately, respectful communication builds trust, strengthens teamwork, and ensures quality care in both face to face and digital interactions.
So for our next topic, it would be about timeliness and responsiveness. First is we must acknowledge and respond to professional communication within 24 to 48 hours unless urgent. Next is respect colleagues' time by avoiding late night or off-duty messages unless the matter is critical. Use features like scheduled send to ensure communication falls within acceptable working hours. Now, as nurses, being timely and responsive in our digital communication is essential. Responding to emails, messages, or online updates within a reasonable time shows professionalism and respect for others. It also prevents delays in patient care and teamwork. If a message is urgent, we must respond to it immediately. For less urgent matters, replying within 24 to 48 hours is expected. Timeliness not only reflects reliability but also ensures smooth collaboration in the healthcare setting. First is we have collaboration and teamwork. First is use digital platforms to foster teamwork, share updates, and collaborate effectively. Encourage respectful dialogue in online group discussions and avoid dominating conversations. Third is always provide sources when sharing information to ensure accuracy and credibility. Netiquette also strengthens collaborations and teamworks. In digital platforms, we need to communicate clearly and respectfully so that every member of the healthcare team feels heard and valued. By sharing accurate information, acknowledging others' input, and maintaining a constructive tone, we foster trust and efficiency. Effective digital framework means better decision making, stronger professional relationships, and most importantly, improved patient outcomes. Next is we have legal and ethical compliance. Nurses must comply with both institutional policies and national regulations governing digital communication. Always use secure, encrypted platforms when transmitting sensitive health information. Breaches of digital professionalism may result in disciplinary action, license suspension, or legal consequences. Now, as nurses, we are bound by strict legal and ethical standards. So, online, this means protecting patient confidentiality, avoiding the sharing of sensitive information, and using secure platforms for communication. Violating these standards can lead to legal consequences, loss of trust, and even suspension of one's license. Netiquette serves as a safeguard, reminding us that every digital action carries ethical responsibility, and that professionalism doesn't end when we log into a computer. And lastly, we have continuous learning. Nurses should engage in ongoing training on digital professionalism, nursing informatics, and cyber ethics. Professional organizations and healthcare institutions should regularly update netiquette policies. Lifelong learning ensures nurses remain competent in using technology while protecting patient rights. Now, in today's digital world, continuous learning is no longer optional, but it is a responsibility. Technology in healthcare evolves quickly, and so do communication platforms. Nurses need to keep updating their knowledge of digital professionalism, privacy policies, and online communication skills. Participating in trainings, workshops, and institutional orientations ensures that the nurses stay competent and ethical in using modern day technology. By embracing lifelong learning, we strengthen our role as safe and effective and trusted nursing professionals. So, in summary, netiquette is more than just good manners. It is a vital part of nursing professionalism in the digital age. By practicing respect, clarity, timeliness, and ethical responsibility, nurses can protect patient safety, uphold confidentiality, and maintain trust in the healthcare team. Together, we can ensure that our digital communication reflects the same compassion and professionalism that define nursing at its core. So once again, I am Kurt Justin John A. Pacaro, and together with my team, we thank you for listening and we hope you learned something from our presentation.